Welcome to another episode of You Can't Handle the Tooth. This is Dr. J, the real floss boss, coming at you with another episode. It has been a couple of weeks. We have been super busy around here, but haven't forgotten about you and happy to do this channel. I get lots of feedback, as I mentioned before. I talk to people from other countries, other parts of this country that have questions about different things. And I get a lot of people that are grateful for this service. So again, this is just me answering questions for you so that you can make the best informed decisions you can for your smile, your teeth, and your health. All right? So the subject for today, a quick one, but it's very important. How often should you see the dentist? How often? It's pretty funny. For years and years, insurance companies have agreed to pay a portion or all of the maintenance visits, you know. So people will go to the dentist about twice a year, right? That's about what they go. Why? Why is it twice a year? And that is for cleanings, for x-rays if needed, and for an exam so the dentist can take a look at the teeth and the x-rays and give you an evaluation. So why is it every 6 months? Honestly, most people come every 6 months, not because that's what's best, but because that's what their insurance will pay for. And that's okay, right? I mean, in most cases, twice a year is pretty good. The ADA has recommended that people should get their teeth cleaned about 3 or 4 times a year. Now, why? Why is that? Why is it so important? Well, you got to think, let's say you have healthy gums, healthy teeth, all right? That means the little pocket, when the hygienist goes around with the probe around the teeth and measures the little pocket depths between the gum and the tooth, you know, we're looking for measurements about 2 to 3 millimeters, okay? If you have pockets that are 4 millimeters or more, 5, that's enough to raise an eyebrow, cause some suspicion. If it's 5 or more, some people have 8, 10 millimeter pockets. These are deep pockets. So if you come, if you're very, very good at home care, meaning you can floss and brush very effectively, like so good you could make a YouTube instructional tutorial on how to brush and floss. You're that good at your home care. The very best brushers and flossers get about 2 to 3 millimeters below the gum. That's the best ones. How many people out there do you think are really good at it? Okay? Now, I'm not being mean. It's just, there's a lot of people who just aren't that effective. They're in a hurry. They don't do it as frequently as they should. And that's just the people with healthy gums. If you do have a 4 millimeter pocket, which plenty of people do, you're never getting there. Just the bristles don't get down that far. You can't floss that deep, which means there's a millimeter or so below the gums in your mouth that never get cleaned until the dentist and the hygienist sees you again, okay? So 6 months is good. At least it keeps you regimented, and at least the dentist or the hygienist can get their eyes on those teeth and gums. They can let you know of anything that comes up. But if possible, 3 to 4 times a year is good, is what's actually recommended. And so, you know, if you don't have insurance, you're paying out of pocket, it can be more expensive. If you do have insurance, you know, think of it this way. You might pay for 1 extra, like 1. You might pay for 1 per year. That will put you at 3 per year, which is much better than what most people do. Now, I'm not saying it's bad to do every 6 months. I'm just saying it's dictated by what an insurance company has negotiated with, human resources department, and that's what they pay for. But the ADA is recommended 3 or 4 times a year. I certainly would recommend 3 or 4 times a year, but I also understand budget is a factor, and that people come twice a year, so no problem. You just don't want to, if you don't come twice a year, things can really get away from you. So at the very least, twice a year, and make sure you ask your dentist. I know my insurance only covers 2 of these per year. Do you think that is a good frequency for me? There have been some patients that I've seen over the years, and I'm like, seriously, your gums are immaculate. You probably don't even need to come every 6 months because it's so good. You do such a good job at home. But most people could really benefit from more than twice a year. What are some other issues that might necessitate you coming more than twice a year? Because everyone's not the same. What if you're pregnant? Well, insurance is going to pay twice per year. Should you come more than that? Absolutely. There are lots of issues that can come up with gingivitis, the bad bacteria in your gums, or even periodontal disease, and some of that bacteria having a negative effect on the fetus. Okay, so really important to keep your gums nice and clean with upgraded home care when you're pregnant. So absolutely more than twice a year when you're pregnant. I mean, at least throw another one in there, right? So you have one every 3 months. What if you have a history of gum disease? What if you have parents that have gum disease? If you yourself have a history of gum disease, highly recommended more than twice a year. Will your insurance pay for it? Probably not. But that doesn't mean that you shouldn't do it, right? In fact, we love insurance. Insurance helps. It helps. But we don't want insurance companies to dictate what treatment you have, assuming you have a trustworthy provider that's got your interest at heart, okay? So there's lots of things to juggle when you're trying to make those decisions. Just make sure you're honest with your provider, asking them about what they think the frequency should be, letting them know what conditions that you have, what histories you've had, what types of things conditions that have run in your family, things like that. So that's about it. You know, twice a year. How about how often? X-rays. Certain X-rays we take, just the bite wing X-rays to kind of look between the teeth to see if there are cavities. Those about once a year. Sometimes you might have some watchers. Dentists call them watchers. Small decay that they can see that's not big enough to get done, to get treated yet. And so they may say, hey, in 6 more months, I want to take another bite wing just to make sure it hasn't gotten any bigger. Is your insurance going to pay for that? Probably not. But you know, it may be necessary if you want to make sure you're being very proactive in attacking that bacteria so that it doesn't get worse. The other thing is insurance. They won't pay for all recommended X-rays all the time. And again, it's just it's because of a negotiated contract that they have. So you don't want to be overexposed. The radiation's really not an issue. I did a Facebook Live on radiation another time. It's on the YouTube channel, I think. But I can address that again if you'd like. The radiation's not a huge issue for most people. I don't mean to say that they don't mind it. What I mean to say is it's not going to cause you any negative side effects for most people. Not going to have an issue for you. So make sure you get at least once every 3 years, you're getting a full set of X-rays that can show the root tips of the teeth so the dentist can really see what's going on in the bone, or maybe even one of those panoramic ones that go around your head. That way we can see everything we need to see. You know, sometimes actually if you don't have those recommended X-rays, the ones that we would recommend, in spite of what the insurance will pay, sometimes the insurance won't cover treatment unless you have the proper X-rays. So you may have the bite wing X-rays and then you need a crown, or you need, something else. Like maybe you need an implant. Sometimes insurance companies won't pay for one implant in one location without a full set of comprehensive X-rays. So the bite wings just won't suffice. Otherwise, they just won't pay for it. And it's just something that you got to make sure you're asking your dentist about, and that your dentist is trying their best. They're trying their best, right, to get all the requirements, check, so that the insurance will keep their commitments to you and reimburse you. But, they can be tricky. So there you go. At least twice a year, consult with your dentist. You may have conditions that would warrant you coming in more than that. Your insurance may or may not pay for it. So make sure you check on that, okay? This is Dr. J, the Real Floss Boss, saying thank you once again for signing in, joining us with You Can't Handle the Tooth. We will see you next week.